But it just doesn't make sense to me why physicians are selling these packages of injections, because that is assuming that you're going to know how these things play out. And I don't have a crystal ball. If they don't have a crystal ball, nobody does. All right, everybody, another episode, Daily Doc Talk. So I had a patient recently who we did a PRP procedure on, and we were talking just about past experience they had with platelet-rich plasma injections for a different area of the body. And this patient had good results, but one of the interesting things is that the provider who did this was an orthopedic surgeon and a very well-known orthopedic surgeon, and their approach didn't really make sense to me. And I mean, I understand that the way that this is done is kind of how research is done, but honestly, I think research in the orthobiologic space is not done properly. What this patient had was, he was told that the series of injections was going to be 5 or 6 injections, regardless of what happens. And this patient went and he had his first injection and he was basically 100% pain-free. And so what did the provider say, the surgeon? Oh, well, we got to do the other 4, like that's what we do. And this surgeon couldn't see outside, like couldn't look past the fact that, look, the patient's better. Why do you need to do 5 of them? Other than the fact that they already paid for it, he probably didn't want to refund it, which I don't like to think that doctors practice that way, but I'm sure there are some out there that do. But it just doesn't make sense to me why physicians are selling these packages of injections, because that is assuming that you're going to know how these things play out. And I don't have a crystal ball. If they don't have a crystal ball, nobody does. I have some patients where we need to do 3 or 4 PRP injections spaced out over a year. I have patients where I only need to do 1 PRP injection and they are pain-free 3 months later, fully pain-free, and we don't have to do anything else. So I just don't get and grasp this idea that these orthobiologic injections of PRP predominantly, or even prolotherapy, need to be sold as packages where patients are getting 4, 5, 6 injections regardless of how they do. It's also interesting that this patient had a slight worsening in his pain when he received the other 4 injections after his first one. It just doesn't make sense to me. I'm still trying to wrap my head around it. This has never made sense to me from day one. Our approach, the approach that I think is best in line with how to support the body to heal, is to intervene with an intervention, a platelet-rich plasma injection, and then track and watch how the body responds over the next 6 to 12 weeks for platelet-rich plasma injections, a little bit shorter for our prolotherapy injections, a little bit longer if we're talking bone marrow or adipose tissue injections. We watch and we track how the patients do, so that way we can make an informed decision for the next injection, as opposed to just making an assumption before the first injection is done on how many this patient is going to need. Because we all know what assumptions do. All right, see you later.